Infection risk after CAR T-cell therapy. CAR T-cell therapy has been a major improvement in the treatment of several blood cancers. There are currently two main types of CAR T-cell treatments. CD19 CAR T-cell therapy targets the antigen CD19, which is expressed on malignant B cells, but also on normal B cells. CD19 CAR T-cell therapy is used to treat some forms of B-cell lymphoma and acute leukemia. BCMA CAR T-cell therapy targets the antigen called BCMA, which is expressed on multiple myeloma cells, but also on normal plasma cells. BCMA CAR T-cell therapy is used to treat multiple myeloma. Antigens, proteins that are expressed on the cell surface of malignant and normal cells. Plasma cells, a type of B cells that can produce antibodies. Both CAR T-cell therapies can, however, also affect the immune system long-term, and patients may remain at higher risk for infections for months or even years after CAR T-cell treatment.
So after the CAR T-cell infusion, there are the acute side effects which occur in the first 2 to 4 weeks after infusion. Those are the cytokine release syndrome and the neurologic toxicity. So after CAR T-cell therapy, we regularly see infections. In the first weeks, those can be bacterial infections, also because before the CAR T-cell infusion, the patients get a few days of chemotherapy. As the CAR T-cells not only eliminate the tumor cells, but they also eliminate the normal B cells. Patients can have prolonged loss of their normal B cells, which means there is an increased risk of infection. And also other cytopenias can occur. Patients can have anemia or low platelets, for which they may need transfusion. In the longer term, what we mostly see is viral infections. They can be respiratory infections, but also reactivations of other viral infections.
There are some patients who may experience infections even during the first 2 or 3 years after treatment, because their immune system is still compromised by the treatment.
You will have very low white blood cell counts, and of course this poses you at risk for infection. However, you receive prophylactic treatment after CAR T-cell infusion, which is against viral infections and against opportunistic infections, bacterial infections.
If the patients have long-term B-cell depletion and low immunoglobulin levels, and also recurrent infections, we can give intravenous immunoglobulin infusions. Those are given once every month, and they give some level of protection against respiratory infections. Also, sometimes we give growth factors, which help to increase the neutrophil counts, so the white blood cell counts, if the patient has prolonged granulocytopenia. And sometimes we give antibiotics prophylactically for some time after the CAR T-cell infusion to prevent infections.
If you experience an infection after CAR T-cell therapy, first is of course that you have to show up at the outpatient ward or call your CAR T treatment center. Another important thing is that you receive a kind of patient card, which you should always wear with you, indicating that you have received this chimeric antigen T cells, and everyone in other hospitals will know that you maybe have a risk for infections.
After CAR T-cell therapy, precautions are not very different from the precautions you've already gone through with your previous treatments. Try to avoid crowded places, try to avoid the rush hour. Perhaps wear a face mask. Don't stay at home all the time. Just leave your home, walk, and try to live a normal life as possible as you can. All in all, this treatment in the long run will allow you to have a normal or almost normal quality of life.
So 4.5 years later now, I do still have side effects. I can't throw viruses when I get them. I just have a virus and it kind of depletes me. I get ill. I've had infections in my mouth, respiratory, I had pneumonia, but I'm alive. What can I say? These things, even if I knew this ahead of time, I'd have still done it because I have life and I'm alive and life is good. And these things are just the price of being alive.
Treatment with CAR T-cells can increase the risk for infections over a long period of time. Some simple precautions can be taken to lower the risk of infections. Stay away from crowded places or be careful and protect yourself. Wear a mask, especially on public transport or in other crowded places. Wash your hands often. If soap and water aren't available, use hand sanitizer. Try not to touch your face with your hands. Follow your haematologist's advice about vaccinations. Follow the advice for people with a weak immune system when preparing or storing food. Take your patient card with you, indicating you received CAR T-cell therapy. Contact your CAR T center urgently if you have signs of infection such as feeling generally unwell, fever, flu-like symptoms, difficulty breathing, feeling cold and shivery, feeling unusually tired or weak, or any other symptom you worry about. In case of an emergency, call for help using the emergency services number for your country or emergency number provided by your treating haematologist. And enjoy a normal life as much as possible.